warrior, I want to talk about something that we don't really talk about too much, but we must. Remember, in talking about exploitation, trafficking, which we at the Warriors call slavery, slavery is a much more descriptive word. The enslavement of people, I don't know how to stress it enough, is going on across America. Remember, we want to start talking about all of this trafficking, slavery, exploitation. I want you to think of it in a new way. I want you to think of it at mass scale. I want you to think of it as a national security threat. I want you to think that it infiltrates every part of our lives, whether you realize it or not. Whether it's crime, whether it's definitely trafficking, exploitation, whether it is drugs, weapons, it is this issue that's a lot more than everybody thinks. It is at mass scale. It is a security threat to our country, a national security threat. There is a war on for our children. So a new report came out, and what we don't talk enough about is this new report reveals how the healthcare system is failing trafficking victims and what we can do to improve some of this. Remember, a lot of these trafficking victims will go to a hospital emergency room. Number one, we always advise, if you can, if you're caught in a situation and you have seconds or minutes to get away from a trafficker, an exploiter, that would be a pimp, go to a hospital emergency room. They are open 24 hours a day. Get there somehow, some way. If you even realize you are being trafficked, exploited. Because remember, a lot of these vulnerable people don't even realize they may be on drugs. They don't even realize they're being trafficked. That's another story. But I want to talk about, so that being said, if people are showing up in emergency rooms, there should be a protocol in place where they are able to help these people. Not only that, a lot of the girls and women, boys and men too, remember, boys are the fastest growing demo in the United States for being victims of sex trafficking. And the labor trafficking is exploding. We have to keep talking about that as well. But these victims are showing up, with infections, with bruises, with cuts, because it's a very violent business. Nobody really wants to talk about that. This is not the Pretty Woman movie with Julia Roberts. It's not The Taken with Liam Neeson and his daughter. This is a brutal, violent trade. That brings me to my next point, why people want to legalize prostitution. Remember, that really means legalizing brothels, legalizing pimps, legalizing traffickers, legalizing sex buying, legalizing all of the criminal element. And remember, we at the Warriors are always talking about minors, children. The emphasis is on children. Of course, all people we're worried about and care for, but right now, minors. And that's the word that's left out in all this legalization of prostitution that people say, hey, sounds great, my body, my choice. It's an empowerment, when we know the demand is for children. So that whole part of the story is left out. But remember, it's a brutal, brutal trade. Nobody's out on the streets working by themselves, empowering themselves. They are under the control of a pimp, a trafficker. And those people, remember, national security threat. Let's take that string a little bit and say cartels. Number one business, human trafficking, sex and labor trafficking. Number one, MS-13, human trafficking, sex and labor trafficking, mostly MS-13 is sex trafficking. So let's get back to the emergency rooms. That's a good note if you come across somebody who asks you about something or what should I do, or just to keep in your mind. My goodness, if anything ever happens to you, you go to a hospital emergency room where they have staff and they're open 24 hours a day. But a lot of these victims pass through these emergency rooms. So this report's from Northeastern University, and shortcomings in our United States healthcare system in response to child sex trafficking victims. It was led by Professor Amy Farrell. We give her full credit for all of this. She is the director of criminology and criminal justice, and she's affiliated with Northeastern University, and underscores that while hundreds of cases are reported annually in Massachusetts alone, the actual numbers are likely higher due to underreporting. Now, we at the Warriors always tell you, whatever numbers we know and we do say to you and tell you about, I always tell you the numbers are higher because any of these crimes surrounding trafficking, exploitation, abuse are very underreported, right? But this new report, and this report I will put in the body of this video so you can read it yourself, emphasizes that healthcare providers often struggle to establish this trust with young victims, kids. Imagine a child, they must be so scared, or they must just be so defiant, or they must be so reliant on that pimp, that criminal, that trafficker. They're scared to open their mouths, or they're told if you say anything, we know where your mother lives, we know where your siblings live, or they're very often told, say I'm your father, say I'm your uncle, kind of thing. So there's got to be a protocol how to separate that potential victim from that adult. So let's talk about this a little bit. So to address the challenges, the report recommends comprehensive training for healthcare professionals to recognize signs of exploitation and to understand the complex relationships between exploitation and health. Now, additionally, to ensure victims are given practical and appropriate care. That again, so many show up in emergency rooms seeking, or these pop-up clinics that we all have in all the states now. They show up for treatment of something. So the first comprehensive examination of the health needs of child sex trafficking victims we're talking about right now. We need to shift the focus from mere identification to providing, now this is the key for everything here, sustained trauma-informed care. Trauma is something that I recommend go back and look at the recent interview I did with Bella Hunake. It's right there on the channel. As a survivor, she talks about co-regulation. She talks about trauma. She talks about how her mind works, and how the survivor community discusses all of this and comes together, and how they're not being taken care of. And she's in no way, Bella, I learned a lot from her. That's why I'm urging you to watch this interview. She's in no way complaining. She is a fighter. She is a leader. She is an advocate. She speaks out. She wants to speak. She currently works HHS, Health and Human Services in D.C. She was on President Trump's 2020. She was named to the Presidential Council on Human Trafficking, which is a group of survivors that will advise on what is needed. But I learned from her in this interview. That's why I want all of you to listen to it. Trauma is something that never really goes away. It's with you for life. So ensuring victims receive care for this, it's not throw the Band-Aid on, shove you out the door. I don't want to know from anything else. We have to have these comprehensive steps in place, and it has to be sustainable, right? We talk about sustaining things. Where does that person go to a safe space? Who's going to be taking care of them tomorrow, not today? So we need to do a lot of improvement, and there are a lot of groups and organizations working in this field, but we need a lot of improvement. Our great allies, Nurses Against Human Trafficking, were able to do an anonymous survey within the last couple of years, and they were able to channel 48 different states they had responses from for nurses, nursing students. And although there's a lot of talk of, oh yes, we know about human trafficking, the report that came back is, it was shockingly something like 2% actually knew what to do if they encountered a victim of trafficking. Because most places, I am sorry, but this is the truth, watch a 15-minute Zoom about trafficking. Take this one course for credit, that may be an hour long. Okay, watch this and check off some boxes. That's it. There was no full-scale, comprehensive plan in place in most places. So we have to talk about how are we going to change this? Because also, if you can identify somebody, right, that can lead. Remember, we have to think of all this because it is so overwhelming and so many people involved in this, right? If we help one a day, one child, one adult, we train a healthcare worker, you know what? We've done our jobs. You have to think like that, because people repeatedly say to me, it won't matter what you do. They're going to keep trafficking. Okay, the reality is, are we going to really abolish and stop all of this? No, but we are going to talk about it. We are going to intervene. We are going to prevent new victims. We are going to empower our kids. We're going to educate, right, and inspire adults that this is unacceptable. That is the warrior way. So this report aims to address laying out the dire needs of victims while recommending ways for healthcare providers to better address these needs. And the exploitation impacts healthcare. It's not only doctors and nurses that can recognize it. We need then, well, we do need them to recognize it, but then they need to be able to know what services they should be advising about and referring these victims to for better health care, for quality, ongoing. We use that word sustainability. You've heard that word a lot. Let's have sustainability for victims of trafficking, of exploitation, of slavery. Because remember, think of human trafficking, national security threat. Our healthcare system, in my opinion, in my lifetime, has always been one big tangled web of a mess. I don't think most people could even understand what really goes on with it. Add on top of this the hundreds of millions of dollars spent on healthcare by victims of modern day slavery, trafficking, impacting the system, taking away from other people. That's the part we don't really talk about. And we're talking about children, our precious children. Every child deserves a safe childhood. Every child deserves a safe space. I leave you with a thought. Emergency rooms, you know about that. But young people that are being commercially, exploited are at a very high risk. I don't have to explain. I'm not a nurse. I'm not a doctor. Of STDs. Some people need to terminate pregnancies. Complications from terminating pregnancies. Broken bones, injuries. What did I start out this video telling you? This is a violent and vicious exploitation, slavery. This is not some cute thing where girls in particular and boys are going to make a lot of money and they're going to be treated really well. They're completely exploited in the name of $1. And that's what it's all about. So minor sex trafficking victims, and we've spoken to a lot of them that are now adults. Constant chronic, stomach pains, stress, malnutrition, headaches. I hear headaches a lot. It's horrible. So despite all of this, the kids do not want to seek out any kind of healthcare, medical, anything, because they're scared. So they're less likely to go to a doctor. And a lot of them actually know, like, okay, when something's wrong with your body or you're sick, you want to get better. Most people do. But they have this feeling of shame and the stigma and discrimination. And so they're not going to seek, right? And they don't want to and we don't want this for our kids to get patched up and sent back out on the streets. So the most significant recommendation from the report is to reimagine the relationship, which is what we want to do at the Warriors, with the healthcare providers, and have the victims, the kids, the minors, be able to relate. It all goes back to reimagining. It all goes back to what I've been saying. None of anything surrounding the exploitation, especially of our children, the abuse of our children, it works to heal, works to make whole. So it's time for everything new. So I'm urging all of you, I'll put the report in the body of the video. I want all of you to read it, be aware. If you're a healthcare provider at all, worker, nurse, doctor, please weigh in. We have to do better. It's 2025. Things are escalating. Our children are being exploited. Unimaginable numbers you're not even hearing about. But I'm here to tell you, we're going to begin to reimagine the whole system. And that will be a lot of my work I want to do in Washington, and we'll be doing reimagining. Join me. Please honor our hashtag Community Creates Change. Don't forget lynswarriors.org, information, headlines every day. And also, if you're in the New York City, New York area, New Jersey, Connecticut, Long Island, May 6th, just around the corner at the beautiful Cutting Room, East 32nd Street between Madison and Park, we are having Community Creates Change, our hashtag, a get-together, a party with survivors and those who have volunteered and donated. And we're going to have music and food and discussion. And our great friends, the investigative reporter Brian Joseph, is flying in from Vegas, along with survivor leader Angela Williams, who's gone through the Lifeway Safe House program. Lifeway, great allies of ours, 2 safe houses. And they wrote a book together. And it's very interesting about crime, hip-hop, corruption in America, and the sex trade. So I want all of you, please, we'd be honored to see you. Come meet us, come see what it's all about, because I can guarantee it's happening, this exploitation, this trafficking, this slavery, in every town, city, and rural area across America. So we have to know what to do. Remember, each and every day, oh, and always thanks for listening. Share these videos. Make sure you're subscribed to the channel. We need to build numbers, build community. But I want to make sure when you wake up each and every day, you go out and be a warrior.